Hi, my name's Stephen with Medicare Assistance Partners. I want to make a video today to cover how Medicare Advantage works with TRICARE for Life. TRICARE for Life is available to folks that have served and typically retired with the military. A lot of them have worked their 20 years, and I look at it as a benefit that's very well earned by that point. But when you become someone at Medicare age and have Medicare available, um, TRICARE for Life works as a backup for that, basically a secondary coverage. Parts A and Part B, you have to have those with Medicare to have TRICARE for Life work. But when you do, any of those copays and deductibles that might apply for the general population don't apply to you. They go away when you have TRICARE for Life, which is it's an amazing benefit in itself. But the question comes up a lot, why would I think about having a Medicare Advantage plan with my TRICARE for Life? Well, if you already get your drugs from the VA, they make Medicare Advantage plans that do not have a drug plan attached to it. And we don't want to change how you get your drugs mailed out, so they make Medicare Advantage only plans without the drug plan built into it. And what that would do for you, I'll kind of cover some of the pros and cons. But one of the pros, one of the biggest ones, is because they don't have to worry about the drug portion of the plan, they give money back to you. So that's called the Give Back Plan, and that's something, again, your plan doesn't cost anything to start with, the Medicare Advantage plans, and so really instantly it's a little income back to you that is applied basically towards your Part B that you would have to pay for. One of the probably the second biggest benefit folks like is original Medicare and then TRICARE for Life, which only pays on what original Medicare pays for, doesn't include normal dental, vision, hearing checks and coverages for those things to cover those exams or glasses or hearing aids. And the Medicare Advantage plans, most of those will include the dental, vision, and hearing benefits. Also wanted to say that you get an over-the-counter benefit on many of the popular plans. That can be used at either going to the company and they will mail those items to you, or you can go to many of your local pharmacies and pick up those toiletries, first aid, things like cough and cold or pain relievers, things like that. Many different items are available. One of the other very well-liked benefits are gym memberships that are included. Many of the popular gyms in your area are covered with their gym memberships. And so actually met a lady today at a health fair that was at a popular gym in our area, and she had some questions about being able to get screenings, and she was actually looking for the folks that come to health fairs from doctors' offices or different medical facilities in the area where they would do balance and hearing tests and things like that. And when I asked her what her coverage was, she said TRICARE for Life. But she said, I can't just go and get seen for, if I want to know if I'm, losing bone density or things like that. On Medicare, you have a new to Medicare physical, but once you've been on Medicare for a while, I think she was about 15 years in, she was wanting to be checked on a yearly basis for some of these things. And so I told her that's one of the big benefits on your Medicare Advantage plan is you have the availability for those annual visits to providers for any of those things. So that's actually a huge benefit, is that when you age, and we're all going to be in that situation as we're aging, we want to be in a situation where our health plan is going to benefit us as much as possible. And so that is a big benefit, to be able to get all of those vaccinations that you would need, get any of those screenings that you're going to need on an annual basis. Now, I want to cover the cons. One of the biggest cons against going from TRICARE for Life to Medicare Advantage is that just original Medicare with TRICARE for Life leaves you with no network. So you can go to any doctor that takes Medicare. Well, it is an agent's job, if they are going to move you to an Advantage plan, to say, who is your doctor, and do you see any other specialists? So who's your primary care? Do you see any ologists or iatrists? And those should be checked. We have a very robust network here in the Omaha area, where most of the top plans are going to cover any of the major hospitals. So we're in a very good situation with those, but we want to verify for you, who is your primary care provider, and are they on the plan, and who are your specialists, and are they covered as well, because we don't want to change those medical situations for you. One of the other questions that we get often is, if I sign up for an Advantage plan Could I somehow lose TRICARE? And that's a fallacy that I think just people worry about because TRICARE is so good. Um, well, that's not really true. If you ever have a network issue, I tell folks, even though the plans have very strong national networks and you can get seen, like if you had a cancer situation, you want to go to one of the national cancer centers, most of the plans have an availability to do things like that. Um, but as well as that, if you wanted to go to one of those providers and they weren't on your plan, you can disenroll from your Advantage plan and go back to original Medicare with TRICARE for Life backing it up. So one of the things I want to mention that go back to probably the last pro is when you're on a typical one of these plans that has no drug benefits, so just Medicare Advantage only, you would see copays and a max out of pocket. TRICARE eats all of those up. So when you're on a TRICARE for Life situation and you would look at one of these plans, any of those copays or the max out of pocket don't apply for you. So it really becomes a great situation where you can kind of weigh out the benefits that maybe you don't have currently into what you want to have in the future. So just wanted to cover that today. Feel free to reach out if you have questions. Again, my name's Steven, and we're the Medicare Assistance Partners here. You can call us toll free at 877-992-2477 or come to visit our website on mapto65.com. That's MAPTO65.com. Have a great day.